Welcome to National Hog Farmer. I'm Ann Hess. We're learning more and more that pig health is rarely shaped by single pathogens. Increasingly, co-infections are being recognized as key drivers of poor performance and increased mortality. Joining us from World Pork Expo to discuss this topic and more is Dr. J.D. Fiechtner, Key Account Veterinarian with Boehringer Ingelheim. Welcome and thank you for joining us today.
Thank you for the invitation.
So, first, give us a little background on the idea of co-infections being key drivers of poor pig performance.
Okay. As a veterinarian, and producers understand when they've been in production systems that there are pathogen and disease challenges, and they all have their own individual name. But as the industry has matured and better testing and diagnostics, we're learning about the interplay of these different disease-causing agents interacting with each other. Within Boehringer, we term that dynamic pig health because it is a dynamic system of the interplay between these diseases and how they can affect the performance and health of the growing pig.
You guys have done some research recently to look closer at this idea of dynamic pig health and how it can be applied in the field. I understand one study involved a co-infection of PRRS and PCV2D. What were some of the key findings of that study?
Yes, I mean, that's a very common co-infection in today's pig industry. And what they found is PRRS is very widespread, so we took a good look at how the PCV2D, type D, interacted in the face of vaccination. And what we found is that the health of those two together, the health of the pig, is more significantly impacted than either by themselves. And also we looked at the immunity to the specific type of PCV2 is important, where they were challenged with a PCV2D and where they were vaccinated with a PCV2D vaccine instead of the more common PCV2A. Sorry for all the letters, but that's what we deal with here. We found that when they had homologous or like immunity from the type D vaccine, they had better performance in the grow finish period. They had less treatments and improved average daily gain in those pigs that had the specific vaccine targeting their challenge. And so this is the part where we say it's dynamic. It's not one size fits all. It's not one bottle fits all. You really have to know and understand your system, your challenges, and tailor your responses and preventative measures in a dynamic way to get the best results.
I was going to just say we need to get specific about those letters in the terms, because when you're targeting at that level.
Yes, when we talk about A and D, those are different genotypes of the porcine circovirus. Type 2 is what the PCV stands for. And it's been around since the early 2000s and was a very huge impact when it initially showed up in the industry. So everybody has a memory of it, and the vaccines do a nice job. But with the research and the testing that's done today, there's ways to tailor your vaccine or preventative measures to get the best results. Because, hey, bottom line is we want to make protein to feed the world, and we want it to be safe, nutritious, and healthy. And the industry needs to do it in an economic and sustainable method. And so we need to do all these things as good as we can to capture all of the values for the business and for the pig.
So another study you had looked at enteric and respiratory co-infection of PRRS and Lawsonia, found that even subclinical Lawsonia can have a compounding effect on poor performance when present with PRRS. Why is this important for producers to consider when thinking about disease control?
This one's kind of unique because it changes the thinking, because one targets mostly the respiratory system, that's PRRS, and then Lawsonia affects the enteric system, or the GI tract. And what was unique about this is weren't suspecting that those two that affect different areas of the pig, when you put them in the same pig together, you saw a measurably different outcome, even with what we call subclinical, or you're not seeing clinical disease, is that it was affecting those pigs more severely than if they weren't there, or even without you knowing. We talk Lawsonia as a silent thief, where it steals economics from you and performance. And what we saw is when you had better protection for Lawsonia in the face of PRRS, you had lower mortality and better average daily gains, which are two measurements that we use to measure performance and efficiencies in the pig.
So what would you say are key takeaways for producers and veterinarians when trying to protect pig health and profitability this year and beyond?
Well, I'll use the word dynamic because it is a dynamic process ongoing. You need to look at all aspects, multi-systems, and really concentrate on doing what's best for your operation and best for the pig to keep the economies going like we need to sustain both the industry and the food production that it entails. Vaccine as a preventative, prevention is better than treatment. Sometimes you have to treat, make sure your treatments are tailored to what you are having issues with, and to consider all the aspects of this. And the first thing, I can't get out of here being a veterinarian without talking about biosecurity, because if you can avoid these things, that's best, but a lot of these things you cannot avoid, so then you have to minimize the impacts to the best of your abilities.
Dr. J.D. Fiechtner with Boehringer Ingelheim, thank you so much for joining us today and sharing your insight.
Thank you very much. Appreciate the time.